Collagen cross-linking is offered to patients who have proven progressive changes as a result of keratoconus. So let's first talk about what are the indications for cross-linking. When I see a patient for cross-linking or a patient who has been diagnosed with keratoconus, I need to document progressive disease to be able to justify cross-linking, because the truth is, cross-linking does not reverse the disease. It rather stabilizes it and freezes it in its track. So if the patient already has stable keratoconus, there's no indication for the treatment. So how do we determine if there's been progression? We look at prior records. Typically, what we need to do, especially if we're hoping that insurance coverage will be part of the discussion, we need to show that in the prior 2 years, prior to their visit with me, that there's been a shift in their refractive cylinder of at least 1 diopter, a shift in their corneal astigmatism, whether it's based on autorefraction, or an increase in their spherical equivalent of myopia of 1 diopter. We then submit that information to the insurance and request pre-authorization. The procedure is done in the office. The steps of the procedure are as follows. I gently remove the corneal epithelium to allow for riboflavin, which is the vitamin that essentially bonds with the corneal collagens, to be infused through the cornea. So for the first half an hour of the procedure, after the epithelium has been removed, riboflavin drops are instilled on the eye every 2 minutes until the riboflavin penetrates through the cornea. Then for the second half an hour of the procedure, we then start the light treatment. Special light is delivered onto the cornea, together with the riboflavin, help form new collagen bridges to stiffen the cornea and stabilize it. So the keratoconus that was previously progressive then is stabilized and hopefully does not progress further. The procedure, as I mentioned, takes about an hour. The patient then gets a bandaged contact lens and returns to see us until the epithelium has healed, after which they then return to you for their follow-up. What you'll notice is that their vision will fluctuate over the next month or so, after which their cornea should stabilize, as should their refractive error. We usually say that you can prescribe them with new contact lenses or glasses about 1 to 2 months after the procedure. Collagen cross-linking is highly effective and in studies has been shown to be greater than 95% effective in stabilizing keratoconus. So I urge you, as the primary eye care specialist, seeing these patients who have new diagnoses of keratoconus, or patients that you already have in your office, you're fitting with contact lenses or glasses, they return to you and you notice a shift in their refractive error, please consider referring them for collagen cross-linking, because you could potentially save them from the need for corneal transplantation in their future. This is a sight-saving procedure that, if it's done early in the course of their progressive keratoconus, vision can be preserved and the patient can be maintained under your care long-term.